In the intricate web of modern healthcare, where every heartbeat and breath matter, one tool stands out as a beacon of continuous vigilance: pulse oximetry. As a silent sentinel monitoring heart rate and oxygen saturation, its ubiquitous presence in patient care settings is both reassuring and essential. However, amidst the rhythm of routine practice, a subtle divergence emerges between tertiary and non-tertiary units, raising questions about the uniformity of its application and its impact on patient outcomes. Delving into this nuanced landscape reveals not just variations in usage but also underscores the imperative for standardized approaches to safeguarding every patient's well-being. The role of pulse oximetry in monitoring heart rate and oxygen delivery, a critical examination of tertiary and non-tertiary healthcare units. In the realm of modern healthcare, the continuous monitoring of vital signs is paramount to ensuring timely and effective patient care. Pulse oximetry, a non-invasive method for monitoring heart rate and oxygen saturation, has become a standard practice in many healthcare settings. Recent research, however, has shed light on variations in the routine use of pulse oximetry across different units, particularly between tertiary and non-tertiary healthcare facilities. This essay aims to critically examine the utilization of pulse oximetry in monitoring heart rate and titrating oxygen delivery, exploring the implications of the observed differences between tertiary and non-tertiary units. Tertiary versus non-tertiary units. One intriguing finding from the study is the comparison between tertiary and non-tertiary units, revealing a marginal difference in the use of pulse oximetry. Tertiary units reported a usage rate of 79%, while non-tertiary units lagged slightly behind at 66%, with a p-value of 0.12 indicating insufficient evidence of a significant difference. This raises questions about the factors influencing the divergence in pulse oximetry practices between these two types of healthcare facilities. Possible explanations and implications. Several factors could contribute to the observed differences in pulse oximetry utilization. Tertiary units, often associated with academic medical centers, may have more extensive resources, access to advanced technologies, and a culture of research and evidence-based practices. On the other hand, non-tertiary units, which may include smaller community hospitals, might face constraints in resource availability and training opportunities. The implications of this disparity are multifaceted. While the lack of a statistically significant difference may suggest that both tertiary and non-tertiary units recognize the importance of pulse oximetry, the numerical gap warrants further exploration. Understanding the underlying reasons for this discrepancy is crucial to developing targeted interventions that can bridge the gap and ensure a more uniform and effective application of pulse oximetry across all healthcare settings. Clinical and research considerations. In clinical practice, the routine use of pulse oximetry serves not only as a diagnostic tool but also as a means of titrating oxygen delivery to meet individual patient needs. Any variability in the adoption of this monitoring technique could impact patient safety and outcomes. Future research endeavors should delve deeper into the reasons behind the observed differences, exploring potential barriers to the widespread implementation of pulse oximetry and identifying strategies to address them. In conclusion, pulse oximetry has emerged as a vital tool in the contemporary healthcare landscape, contributing significantly to the monitoring of heart rate and oxygen saturation. The observed differences in its routine use between tertiary and non-tertiary units underscore the need for further investigation. Understanding the factors influencing these variations is crucial for developing targeted interventions that can optimize pulse oximetry utilization across diverse healthcare settings. By fostering a more standardized approach to patient monitoring, healthcare professionals can ensure that the benefits of pulse oximetry are universally realized, enhancing patient care and safety. Summary. This essay explores the utilization of pulse oximetry in monitoring heart rate and oxygen delivery across healthcare units, with a particular focus on the observed differences between tertiary and non-tertiary facilities. It begins by highlighting the importance of continuous vital sign monitoring in modern healthcare and presents findings from a study indicating variability in pulse oximetry usage among surveyed units. Notably, while pulse oximetry was used routinely in 30% of units, data for 10% of units were not provided. The essay then examines the comparison between tertiary and non-tertiary units, revealing a marginal difference in pulse oximetry usage rates, 79% versus 66%, respectively, with insufficient evidence of significance. Potential explanations for this disparity are discussed, including resource availability and institutional culture. The implications of these differences for patient care and outcomes are highlighted, emphasizing the need for further research to understand the underlying factors and develop targeted interventions. In conclusion, the essay underscores the importance of standardized pulse oximetry utilization across healthcare settings. It advocates for deeper investigation into the reasons behind observed variations and the development of strategies to optimize pulse oximetry implementation. By fostering a more uniform approach to patient monitoring, healthcare professionals can enhance patient safety and quality of care. There are some words and their meanings. 1. Pulse oximetry. Pulse oximetry is a non-invasive method for monitoring heart rate and oxygen saturation in patients. 2. Tertiary units. Tertiary units are healthcare facilities associated with academic medical centers, providing specialized and advanced care. 3. Non-tertiary units. Healthcare facilities are typically found in community settings, offering basic medical services. 4. Vital signs. Essential physiological parameters such as heart rate, blood pressure, and temperature. 5. Oxygen delivery. The process of providing supplemental oxygen to patients to maintain adequate oxygenation. 6. Monitoring. Monitoring is continuous observation and assessment of the patient's physiological parameters for early detection of abnormalities. 7. Heart rate. The heart rate is the number of heartbeats per minute, indicating cardiac function and overall health. 8. Oxygen saturation. Percentage of hemoglobin in the blood that is saturated with oxygen, reflecting tissue oxygenation. 9. Routine use. Regular and standardized application of a medical procedure or intervention. 10. Patient care. Holistic management of patients' health needs, encompassing diagnosis, treatment, and support. 11. Research. Research is a systematic investigation aimed at expanding knowledge and understanding of a particular subject. 12. Evidence-based practice, an approach to healthcare that integrates the best available evidence with clinical expertise and patient values. 13. Variability. Differences or variations observed among individuals, groups, or settings. 14. Resource availability. Accessibility of facilities, equipment, and personnel required for patient care. 15. Institutional culture. Shared values, beliefs, and practices within an organization that influence behavior and decision-making. 16. Patient safety. Measures and protocols aimed at preventing harm to patients during healthcare delivery. 17. Outcomes. Outcomes are the results or consequences of healthcare interventions or practices on patients' health and well-being. 18. Standardization. Standardization is the process of establishing uniform practices or protocols to ensure consistency and quality in healthcare delivery. 19. Intervention. Intervention is action taken to improve or modify a particular aspect of patient care or healthcare practice. 20. Care quality. Level of excellence or effectiveness in delivering healthcare services and achieving desired patient outcomes. Here are some questions and suggested answers based on this content. 1. What is pulse oximetry? Suggested answer. Pulse oximetry is a non-invasive method used to monitor heart rate and oxygen saturation levels in patients. 2. What percentage of healthcare units surveyed routinely used pulse oximetry? Suggested answer. According to the essay, 30% of units surveyed used pulse oximetry routinely. 3. What types of healthcare units were compared in terms of pulse oximetry usage? Suggested answer. Tertiary and non-tertiary healthcare units were compared in terms of pulse oximetry usage. 4. What was the difference in pulse oximetry usage between tertiary and non-tertiary units? Suggested answer. Tertiary units reported a usage rate of 79%, while non-tertiary units reported a usage rate of 66%. 5. Was the observed difference in pulse oximetry usage between tertiary and non-tertiary units statistically significant? Suggested answer. No, the observed difference was not statistically significant, with a p-value of 0.12. 6. What are some possible explanations for the observed differences in pulse oximetry usage between tertiary and non-tertiary units? Suggested answer. Possible explanations include differences in resource availability, institutional culture, and training opportunities. 7. Why is pulse oximetry considered important in patient care? Suggested answer. Pulse oximetry is important in patient care because it provides valuable information about heart rate and oxygen saturation, which are crucial for monitoring patient health. 8. What are vital signs, and how are they relevant to healthcare? Suggested answer. Vital signs are essential physiological parameters such as heart rate, blood pressure, and temperature. They are relevant to healthcare as they indicate overall health status and help in the early detection of abnormalities. 9. What is the significance of oxygen delivery in patient care? Suggested answer. Oxygen delivery is significant in patient care as it ensures adequate oxygenation of tissues, which is essential for various physiological functions. 10. What is evidence-based practice in healthcare? Suggested answer. Evidence-based practice in healthcare involves integrating the best available evidence with clinical expertise and patient values to inform decision-making and improve patient outcomes. 11. How does institutional culture influence healthcare practices? Suggested answer. Institutional culture, which comprises shared values, beliefs, and practices within an organization, can influence healthcare practices by shaping behavior and decision-making processes. 12. Why is standardization important in healthcare? Suggested answer. Standardization is important in healthcare because it helps ensure consistency and quality in healthcare delivery, leading to improved patient outcomes and safety. 13. What are some potential implications of variations in pulse oximetry usage across healthcare units? Suggested answer. Some potential implications include disparities in patient monitoring practices, which could impact patient safety and care quality. 14. How can research contribute to addressing disparities in healthcare practices? Suggested answer. Research can contribute by identifying underlying factors contributing to disparities, informing the development of targeted interventions, and evaluating their effectiveness in improving healthcare practices. 15. What measures can be taken to optimize pulse oximetry utilization across diverse healthcare settings? Suggested answer. Measures may include standardizing protocols, providing training and education, and ensuring access to necessary resources and equipment. 16. How does pulse oximetry contribute to patient safety? Suggested answer. Pulse oximetry contributes to patient safety by facilitating early detection of oxygenation issues and allowing prompt intervention to prevent adverse events. 17. What are some potential barriers to the widespread implementation of pulse oximetry? Suggested answer. Potential barriers may include resource constraints, a lack of training, resistance to change, and variations in institutional policies. 18. What role does patient care quality play in healthcare delivery? Suggested answer. Patient care quality plays a critical role in healthcare delivery as it reflects the effectiveness, safety, and satisfaction of patients receiving medical services. 19. How can healthcare professionals ensure the uniform application of pulse oximetry across different healthcare settings? Suggested answer. Healthcare professionals can ensure uniform application by promoting standardized protocols, providing training, fostering collaboration, and monitoring adherence to guidelines. 20. What are the implications of addressing variations in pulse oximetry usage for patient outcomes? Suggested answer. Addressing variations in pulse oximetry usage can lead to improved patient outcomes, including enhanced safety, better monitoring, and more timely interventions to address oxygenation issues. This material primarily helps to learn English vocabulary, English grammar, and English sentence structure. Thank you for watching.